Thank you all very much for being here. Today I want to take some time to address Nevadans about where we are in our fight against COVID-19. I want to be upfront and talk to you directly because since the start of this pandemic, I promised to be honest with all of you, to lay it out. You deserve that, and I know Nevadans can handle that. So today I'm going to take some time to lay out where we are, where we may be headed, and what we can do. First off, I want to be clear right away. I am not here to announce capacity limits or closures or anything like that. In fact, everything we're currently doing is aimed at preventing just those scenarios. Every vaccine event, every mask we wear, every effort state and local officials and partners are making is to protect not only your health, but Nevada's economy, our businesses, your jobs, and our quality of life. In a moment, I'll walk through some of the steps I'm taking to make sure we don't go back. But first, I want to address something else. I know everyone is frustrated. I am too. This pandemic puts us all in an ever-evolving situation that can result in a roller coaster of do's and don'ts and changing guidance. I know that can be tough, especially when we were all starting to feel a lot better. I know many of you felt that frustration recently when we had to impose the mask requirements based on new CDC recommendations for individuals vaccinated or unvaccinated in counties with high levels of COVID-19 transmission. Unfortunately, almost all of the Silver State is considered to have high levels of transmission. Trust me, the last thing I wanted to do was to require Nevadans to put their masks back on, especially those who did the right thing and rolled up their sleeves to get their shots. But at this moment in time, with the Delta variant raging through our state, we need our mask as a bridge to mitigate the spread and buy more time as Nevadans get fully vaccinated against COVID-19. And let me be clear, vaccines are the way out of this pandemic. They are the way out of the pandemic. When we rolled back our mask mandate in May, Delta was less than 1% of the cases. Today, Delta is greater than 90% of the cases in Nevada. And according to the CDC, vaccinated people exposed to Delta may be as contagious as the unvaccinated, but have much less severe symptoms. I understand that this is frustrating, but the unfortunate reality is that whether we like it or not, this virus mutates, and we must evolve along with it to protect not only your health and safety, but our economy and our jobs. Let me put it this way. Imagine COVID-19 like a hurricane. I know we don't see many of those in Nevada, but bear with me for a second. If you live in an area prone to hurricanes, there's a common understanding among communities as to how you respond to different categories of the storm. If it's a category 1, you may only need to take a few precautions, making sure your house is watertight and finding some spare batteries for the flashlight. But as the category of the hurricane changes, so does the response. You move gradually to battening down the hatches with sandbags and eventually evacuating the area completely. As the hurricane approaches landfall, the category may change depending on a number of factors. As the category of hurricane changes, so does the response on the ground. In Nevada, a more apt analogy might be wildfires. As conditions on the ground change, our firefighting efforts make headway or wind shift. Our response efforts change as well. Northern Nevadans are used to this kind of a response. They understand that due to factors out of our control, the situation may evolve and a response must evolve as well in order to keep ourselves and our families safe. We've got to think about COVID-19 in the same way. This virus has continued to change and mutate, and a response must change and evolve as well. We started with the original virus, and now we're facing the Delta variant, and it is spreading like a wildfire. Our response has to change to meet the moment. That's why the mask mandate is back in Nevada. Masks will help us slow the spread while more Nevadans get the vaccine. I understand that this feels like a roller coaster to so many Nevadans. In the first year of this pandemic, we were without the vaccines, and our measures to fight the virus were imperfect. We implemented restrictions, and when numbers got better, we loosened restrictions. When restrictions loosened, the cases went back up, and so on and so forth. It was disruptive to everyone's life. We don't want to operate in that world again. And here's the great news. We don't have to. Unlike previous waves of this virus, we have a real solution this time. The COVID-19 vaccines. That's our solution. The vaccines are incredibly effective at preventing severe illness, hospitalizations, and death from COVID-19. In Nevada, almost every COVID-19 death that we have seen since January of 2021 has been in the case of an individual who is not fully vaccinated. Again, almost every death we have seen since January of 2021 is in individuals who have not been fully vaccinated. We've been hearing a lot recently about breakthrough cases, people who are fully vaccinated but tested positive for COVID-19. This has led to people wondering whether it's even worth it to get the vaccine. The answer is a resounding yes, it's worth it. Because while reports of breakthrough cases may seem increasingly frequent, the vast majority do not end up having a severe disease. And as we see, vaccinated patients are not ending up in the hospital and are not dying from COVID-19. We know the vaccines are working. In fact, nationwide, the rate of hospitalization from breakthrough cases is below 0.004%. That's 4 1/1000ths of a percent. And the rate of death is under 0.0008. That's 8 10,000ths of a percent. About the same as the annual risk of dying from drowning. If you're still not convinced by the facts that vaccines are still our most powerful tool against COVID-19 and its variants because they protect against hospitalization and death, let me reinforce another reason why vaccine is the only way to bring an end to the pandemic. I've spoken at length about Nevada's Balancing Act and about the delicate and vulnerable position our state is in because of the pandemic. Just like last year, our economy is not as diversified as other states. Our largest industry of hospitality and tourism is based upon visitors feeling confident to come here to visit. This industry, our hospitality industry, keeps hundreds of thousands of Nevadans employed and keeps a roof over their heads. It supports countless small businesses and funds our state budget so we can provide services like education and mental health care. Our economy has started to come back stronger and begin to recover. And while we have a lot of work to do, thousands of Nevadans are back on the job. I want to continue on that trajectory. As your governor, it is my job to consider all of this and to ensure I'm making decisions not just based on today, but also based on what could happen to our state in a few months if we don't get this right. Because frankly, there is no other state in the country where striking this balance is more challenging or where the consequences are more severe in getting it wrong. And let me be clear on one more thing. This isn't just about our visitors. It's about Nevadans. It's about jobs. It's about going to the homecoming or the prom, seeing your children's dance recital, or attending a school play. It's being able to protect our quality of life and the things we love to do right here in our state. It's about our families. As I walk through the steps I'm taking, I want to assure you that they are all aimed at protecting the things that we love. And I'm asking all of you who have yet to get vaccinated to please join this effort. Myself and other officials will do everything we can, but we need all Nevadans to meet us halfway. Do it for Nevada. Unless we increase our vaccination rates quickly, the virus will have time to mutate again. The unvaccinated will continue to fill our hospitals and place unnecessary strain on our ability to treat all patients, and our economic progress will be threatened as a result. That's why we're masking up, to slow the spread as more Nevadans, as soon as possible, roll up their sleeves and get their shots. And here are the steps the state is taking in these efforts to continue our recovery, to avoid rollbacks, and to make sure we can all continue our progress. This week, I sent a request to my medical advisory team for recommendations in 3 areas. First, I'm asking my medical advisors to look at vaccination requirements for all students attending in-person classes at our public colleges and universities under the Nevada system of higher education. Subsequent to my request to the MAT, I was made aware that the NC COVID-19 task force unanimously recommended that the COVID-19 vaccine be required for those attending their institutions. Assuming that my medical advisory team is in agreement with those on the NC task force that believe this is necessary for Nevada's highest education institutions to join the hundreds of colleges and universities across the country in requiring COVID-19 vaccinations, the Nevada Division of Public Health and Behavioral Health will bring forward proposed regulations to the State Board of Health for consideration. Public health officials have already begun discussions with the appropriate partners, including those at the System of Higher Education, to explore implementation of a timeline that would consider how long it takes to complete full vaccination with the upcoming academic calendar. I want to ensure those returning to campuses in the coming weeks that this will have no impact on your ability to return to classes this semester. If this is the direction taken, health officials will work with NSHE and higher ed partners to make sure any timeline is fair and is reasonable. You should expect a Board of Health meeting to be agendized in the very near future to address this. Second, I'm asking the medical advisory team for a vaccination recommendation regarding those who work with vulnerable populations, like those in institutional settings, those working with the homeless community, and those working in our healthcare system. These recommendations will help guide conversations and actions we can take moving forward. And I'm not afraid to take bold actions. And I look forward to reviewing the guidance and working with officials and partners to implement as necessary. More updates will be provided as we review recommendations and begin conversations with impacted parties and local officials. Finally, I am asking these medical advisors to look at how we can make large gatherings safer. Nevada is an incredible location for concerts, sporting events, and so much more. We have a mask mandate in place, and I implore all Nevadans attending a large gathering to take it seriously and to keep their masks on. However, understanding that the Delta variant is more infectious than anything we've seen before in this pandemic, and having thousands of people in indoor settings, many of whom are unvaccinated, is high risk for everyone. That's why I've asked for recommendations on how these venues and large gatherings can do this right and how we protect one another. When I get these recommendations back, I will be working with local officials, event managers, and operators of our largest venues to discuss how they can best implement safety protocols. We've all seen private sector leaders step up to help in these efforts, and I'm hopeful they'll continue to work with us to accomplish these goals without a government mandate or another directive. Again, this isn't for our visitors. This is so Wolfpack and Rebel fans can go to a game, so parents can watch their kids perform in the school play, and so friends can see their favorite artist in concert. It's so Nevadans can enjoy the best that this state has to offer, and our communities without the threat of spreading a dangerous virus. As these recommendations come back, you'll be hearing updates from myself and state officials. Again, our goal is to avoid rolling back. Finally, yesterday we released requirements and strong recommendations related to masking and testing and other mitigation strategies for K-12 schools. Hundreds of thousands of Nevada school children will go back to school in the coming days and weeks, and many of them are not yet eligible for the COVID-19 vaccines. If children must be quarantined, it interrupts their education. It pulls them out of classrooms they're at with their friends. It means parents have to miss work, potentially affecting their employment and their ability to provide for their families. When adults get vaccinated, they protect those who can't get vaccinated. And because children under 12 are unlikely to become eligible for a few more months, we have an obligation to protect them and help ensure that they have a smooth and successful school year. They missed so much last school year, and I don't want them to miss it again this school year. I want to again ask all Nevadans who have not yet gotten the vaccine to please consider doing so as soon as possible. Talk to your medical professional. Talk to your friends that understand the vaccine and have gotten the vaccine. Amid the surge of Delta variant, we had our largest percent increase in first doses since early June, and first doses climbed for the 4th week in a row. I'm so proud of that. Between July 25th and August 1st, almost 3.5% of eligible unvaccinated Nevadans got their first dose. That's a 21% increase from the previous week and higher than the U.S. average of about 3%. You can visit nvcovidfighter.org to learn more and to find locations that are available for vaccines.